Everyone turn and wave to the camera, please. Is that everybody? Okay.
The Declaration of Independence states that all individuals have unique, unalienable rights, and among those are life, liberty, and the pursuit of happiness. Now, those are just rights at a high level. If we look more in depth at those unalienable rights, we will find that they are more complex than one may first think at first glance. And among those rights, it gives us a broad sense of self-fulfillment and a well-being. So with that, I believe that we have the right to affordable and accessible health care. And we will find that here in the United States, our healthcare is quite expensive compared to most other countries. And a lot of other countries in the world have transferred over to a universal healthcare system. And we will see that here in this map. We have countries that have a single payer, universal healthcare, or private payer healthcare. And you can see here in the US, we have mixed non-universal healthcare. And so what that means is that we have health insurance either through our employers that we pay a premium with, or you may have health insurance through the marketplace, or you may not have insurance at all. And so we'll find that about 56% of the population here in America is insured, and they feel like they are able to afford all services that they may need. 23% are insured, however, they are underinsured. And what that means is that their premiums, well, not their premiums, but their out of care costs make up more than 10% of their take home pay. This includes like things such as deductibles, co-payments, co-insurance. 12% are insured with some type of coverage gap throughout the year, and then about 9% of the population is uninsured. And you will find that many people who are insured, they will either not get their prescriptions filled, or they may not get certain services that they need to stay healthy due to those costs that they have to pay. And through a survey, they found that about 1/3 of people under the age of 65 skipped out on getting their prescriptions filled within the last 12 months because they thought that the cost was too high. And we will also see that our annual health expenditures for health insurance in the United States is much more expensive in comparison to other countries. With the comparable country average, it's almost twice the amount. Now, you may ask, what can we do to combat this? Well, we can try to work our way towards universal health care, or we can try to find other ways to make healthcare more affordable. Now, this may include things such as finding some type of funding source for healthcare. So we can kind of see this already in place for certain things such as Medicaid, Medicare, and even on the state level, here in Florida, we have Florida Kid Care. For when people have children, they can enroll in Florida Kid Care, where they pay a premium out of pocket. But when they go to the doctor, they don't pay co-payments, they don't have co-insurance, they pay one price for the month, and they can take their kid wherever they need to get whatever service they may need, even if they need special treatment. Another way that we can help strengthen our healthcare system is strengthen the providers and focus more on a primary care, where we all go to our primary care doctor every year, get whatever blood work, prescriptions, whatever service we may need to stay healthy. And we can also focus more on things that are more simple, such as our eating habits and getting regular exercise. It is found that people who exercise regularly do live much longer than those who don't. And when we focus on these things, we can do better for ourselves and focus on getting to where we want to be in the long term. And maybe through hard work, through many years, we can maybe eventually get to that healthcare system. And so just to recap, here in the United States, we do pay much more for our health care in comparison to other countries, and we can focus on things such as strengthening our healthcare system, finding other ways of funding of government subsidized healthcare, and focus on simple things that we can do individually to help better our health. Thank you.